Hi and welcome back to part 2 of Module 6, our stress module, where we will be discussing some metagenics stress protocols. So the Identity Stress Assessment is a metagenics stress assessment tool that incorporates a simple 3-step approach, allowing for a personalized approach to managing your patient's stress. It starts with identifying the stress type, and matches that stress type to the appropriate nutraceutical formulation, and then finally rounds it off with the inclusion of stress and diet relief tips. This 3-step approach helps you to distinguish the frequency of perceived stress at the psychological, emotional, cognitive, and physical levels. It helps distinguish between acute and chronic stress, as well as overactive or inadequate stress response patterns. It then matches the individual to the 6 stress patterns and aligns that with specific nutraceuticals and lifestyle support. The questionnaire is very useful in building patient rapport and engages the patient in sharing how they feel day to day. It can help to bring up issues that may otherwise have been overlooked and helps you to target stress, which may very well be contributing to the reason they came looking for help in the first place. The first step is to complete the stress questionnaire, which can either be printed in the PDF format and filled out in your office, or emailed in the electronic format and saved and sent back to you. Using the questionnaire combined with the scorecard, you can determine whether the individual is suffering from a prolonged stress response, whether they tend to be predominantly overactive or inadequate in their stress response, whether there are any sleep concerns present, what the status of their adrenal function is, and then you classify them according to a particular stress subtype. So what you need to do is have the patient select the appropriate responses based on the severity of the way they experience a variety of symptoms. There are 5 sections in the questionnaire, sections A through E. Each section needs to be tallied up to get a total. Section A correlates with the stress subtype called stressed and wired, which is an overactive, prolonged stress response. These kinds of patients present with anxiety and nervousness as their predominant concern, and will often experience physical symptoms of anxiety such as heart palpitations and hot flushes. Section B is another kind of overactive, prolonged stress subtype called stressed and worried. These individuals suffer more from a mental type of anxiety and may appear calm on the outside, but internally they feel pent up and they tend to snap very easily. Both the wired and the worried subtypes can suffer from insomnia and the inability to switch off. Section C of the questionnaire is looking predominantly at adrenal cortisol metabolism, which can contribute to both prolonged overactive and inadequate stress responses. It looks at symptoms such as lowered immunity, frequent headaches, body aches and pains, generalized fatigue, and low blood pressure. The last 2 sections of the questionnaire are looking at the inadequate stress response types. Section D correlates with stressed and mentally exhausted or fatigued, where an individual is experiencing the effects of chronic stress at predominantly a cognitive level. So things like memory and concentration are becoming impaired, but physically they are still capable of performing what is required of them. Section E, on the other hand, is stressed and tired, and these individuals are so severely exhausted that they are experiencing the fatigue at predominantly a physical level, where things like daily tasks become too much for them and libido starts to lag, and they become very prone to depression. The next step is to add up the subsections A, B, and C, and C, D, and E to get a grand total. These subsections represent the 2 main stress response shifts. A, B, C represents the overactive stress response shift, while C, D, E represents inadequate or underactive. The final portion of the questionnaire looks at some relevant lifestyle and dietary stressors, which are important factors to consider. Here you can note meal frequency, alcohol and coffee intake, as well as prescription medications and supplements that they might be using. Now, use the scorecard to guide you through interpretation of the results. We will run through the process step by step. Step 1 is to differentiate whether the patient's score places them in the occasional or the prolonged stress response, and whether their adrenal score is high enough to warrant adrenal support. Transfer the subsection totals for ABC and CDE from the questionnaire to the scorecard. Then, transfer all the section scores A, B, C, D, and E to the left column of the scorecard. There is also space to record the actual responses for the sleep-related questions. There are 3 sleep-related questions in the overactive subsection, which indicates more of a problem with sleeplessness or insomnia. There are also 3 sleep-related questions in the inadequate subsection, which indicates a tendency to oversleep. You can see them outlined here. The overactive section or sleeplessness concerns would be in questions A12, A13, and B7, while the questions pertaining to oversleeping would be in the inadequate subsection, which the questions there are D8, E9, and E12. So you need to write the actual numbered responses to those particular questions in the appropriate spaces on the scorecard. Next, to determine whether the patient has occasional stress or eustress or a prolonged stress response, you need to look at the subsection scores. If the score in both subsections are less than 35, then you would mark eustress on the right-hand side of the scorecard. If either of the subsections is greater than 35, however, then that indicates a prolonged stress response. The next step involves looking specifically at section C. The protocol here is that a score greater than 10 requires adrenal support, while a very high score of 21 or more would indicate the need for additional support. Please note that section C scores may be elevated in both eustress and prolonged stress states, and that's why you always need to evaluate this section independently. Now remember, if the score for the subsections, either of the subsections, had a score greater than 35, then what needs to be determined now is whether that prolonged stress response state is predominantly overactive or inadequate. You do this by subtracting the subsections' subtotals from each other. So you take the total for ABC and you subtract the total for CDE from that. A difference greater than 5 in either direction indicates the predominant shift. But what happens if the difference between those two subsections is less than 5? Let's say ABC was 63 and CDE was 60. The difference there is 3, that's less than 5. You can't clearly say that their predominant shift is in the ABC overactive direction. What you then need to do to differentiate whether they're predominantly overactive or inadequate is scan the questionnaire and note in which subsection the patient has indicated more 3 responses, indicating more frequent and severe perception of symptoms. So whichever side has more 3s, you just add them up. You would then allocate the predominant HPA shift. So if you counted 10 A's in the ABC subsection and only 5 threes. You need to count the 3 responses. If you counted 10 3 responses in the ABC subsection and only 5 3 responses in the CDE, then the predominant shift would be ABC, which is overactive. All right. So now you need to look at the individual section scores for A, B, and D, and E. If the patient was predominantly in the overactive stress response type, then you need to look at sections A and B and see which section score is greater. If A is greater than B, then this correlates with the stressed and wired subtype. If B is greater than A, then that's the worried subtype. Remember, both wired and worried are subtypes of the overactive HPA response. If their shift placed them in the inadequate or underactive stress response type, then check whether D or E is greater. If it's D, then they would be classified as stressed and mentally fatigued. And if it's E, then they're classified as being stressed and tired. The final step is to look at the sleep questions, which you transferred the scores of, and you need to check if any of them scored a 3 response for any of those particular questions. If so, then you can offer sleep hygiene advice and possible additional recommendations for sleep support. Although it should be noted that very often the core stress formulas, which we're going to discuss in a moment, which will have a positive effect on their overall sleep experience and can dramatically improve issues related to insomnia and sleep quality. There is space on the scorecard to note sleep support requirements, as well as any fundamental wellness recommendations which could be added to the protocol if not already in place. Things like a multivitamin, an omega-3, and so forth. Here are some examples of sleep hygiene principles that you could go over to assist your patients with their sleep. Maintaining a regular sleep schedule, establishing a regular, relaxing bedtime routine, creating a sleep-conducive environment that doesn't have any artificial light, the room isn't too warm and so forth, having a comfortable mattress and pillows, finishing eating 2 to 3 hours before your bedtime, avoiding any caffeine before bed, and so forth. These are all very useful sleep hygiene tips that can help your patients get a better quality of sleep. Right, so now that you've managed to classify your patient's stress subtype, the next step is to match it to the appropriate plant adaptogens that can buffer and modulate the specific imbalanced stress type effectively and safely. Now, if you recall from part 1, botanical adaptogens can be used to balance the way your brain and endocrine system process stress, thereby reducing the damaging effects of prolonged exposure to HPA production of catecholamines and glucocorticoids, your stress hormones. These webs represent the different adaptogen-based formulas that we have matched to the different stress subtypes. Notice that each adaptogen mixture has a different focus and hence pattern. These patterns, their differences are based primarily on the traditional applications of the various adaptogenic herbs. Regarding the plant adaptogens, they can either calm or stimulate the HPA axis. All plant adaptogen formulas directly or indirectly replenish the adrenal glands and should be used for a minimum of 3 months, but 6 months is preferable. When you use any botanical products from Metagenics, we use the Metabotanica method to ensure the safety and authenticity of the plant, which looks at the specific genus and species from which the science is leveraged to ensure the efficacy of our formulations. We have a number of ways to verify that the ingredients that we use in the formulas are what we want them to be. We send the ingredients out for third-party authenticity testing, where we look at the genus and species and plant part, and also determine biological activity by employing such tests such as high-performance thin-layer chromatography and high-performance liquid chromatography, which is used to identify the presence of selective actives in the finished plant extract. So we work with third-party verification with all of our ingredients. This not only ensures that they will contain what we state on the product label, but also that the plants that we use are not contaminated with things like heavy metals, pesticides, or microbial contaminants. All of our formulas are also backed by a scientific rationale for the combination of ingredients based on their demonstrated activities or from ancient traditional formulas from either traditional Chinese or Ayurvedic medicine. So, for those individuals that do not score greater than 35 in either subsection, but still suffer from occasional stress, like exam jitters or butterflies during a job interview, consider the formula called Nucera, a formula that provides a very unique ingredient called casein tryptic hydrolysate, or CTH, which is essentially a peptide derived from milk protein. CTH works to tone down the intensity of stress, making it easier to think and maintain grace under fire. The amount of milk that one would have to actually drink in order to get a therapeutic dose of this particular peptide would equate to 400 glasses. So not very reasonable to get that from your diet. So using it in an extracted therapeutic dosage form is a lot more manageable. The actual active CTH has been tested on over 100 subjects and has been the subject of 3 published clinical trials. Results suggest that it reduces the intensity of the physiological reactions triggered by stress, especially in highly reactive individuals. It really helps to take the edge off stressful moments and is very convenient to use in that it is in the form of a chocolate chewable tablet and is delicious tasting. So you would chew a tablet and within 15 to 20 minutes you get that calming effect. It is advised not to exceed 4 tablets per day, as this could lead to drowsiness. And you need to avoid using this particular formula if consuming alcohol or already taking benzodiazepines. So what do you do if your patient had an elevated overactive score, with A being greater than B? This would place them in the stressed and wired category, and the appropriate formula for them is called Serenogen. Serenogen is a traditional heart-calming formula for those who are stressed and wired. This correlates with a high score in Section A and is a combination of a number of traditional Chinese ingredients. You can see them listed there: Rehmannia, Schisandra, Jujube, and Dong Quai. The formula intent is to calm a hyper-aroused stress response and the effects that stress response has on the cardiovascular system. For many people, the target of psychosocial and emotional stress is the heart and circulatory system. Agitation, anxiety, acute stress and blood pressure go hand in hand with chronic stress. Over time, cholesterol rises and arteries harden. Rehmannia and Schisandra are used traditionally to reduce a sense of overwhelm, anxiousness, and support cardiovascular function and blood sugar balance. This is a traditional mixture with a traditional method, and the overall action of this blend combines 12 different herbs. The most important point is the effectiveness of this formula is due to the specific combination of herbs and how they are prepared. By undergoing simultaneous extraction in water, called a decoction, the finished mixture exhibits true synergy, where the combination is greater than the sum of its parts. As mentioned, this is based on a traditional Chinese medicine formula that is used around the world today, but which originated around 1279 and was called a nourishing yin tonic for people who are experiencing exhausted reserves. It supports the kidneys and adrenals as well as the cardiovascular system. And if you look at the symptoms, you'll see palpitations, restlessness, uneasiness, poor concentration. Basically, it's about adrenaline or sympathetic dominance. You'll notice that these individuals suffer from hot flashes, they overheat, and so basically, hydration is also a very important part of working with people who are stressed like this. So this is the formula, which, as mentioned, is a decoction, which basically means that all of the herbs are put into a pot together with water and cooked together for a certain amount of time. The tea is then drained and then the dregs thrown away. The tea is then dehydrated and concentrated into the tablets, which then contain the actives. Rehmannia is one of the chief herbs in this formula, making up to 35% of the mixture. The science on Rehmannia, or Chinese foxglove, is rather profound, and we know that it can have an anti-inflammatory effect. So it calms down the stress response by reducing inflammatory messages. We know it supports hepatic detoxification and clearance or biotransformation, and in human and animal studies, it has been shown to be anti-rheumatic, works against eczema, is a cardiotonic and diuretic, and is one of the main herbs used in China for metabolic syndrome, as it has a hypoglycemic effect. And remember, alterations in blood glucose metabolism are a common finding in individuals under chronic stress conditions and leads to many of the health challenges associated with the stress syndrome. Here is some very current research on Rehmannia, or Chinese foxglove. It is a plant that continues to move forward and gather a tremendous amount of interest around its activity, and we can see benefits ranging from immune, endocrine, and nervous system applications. So Serenogen actually contains a specific combination of 12 different herbs, of which Rehmannia, Schizandra, Jujube, and Dongquai are some of the top line herbs, with specific adaptogenic properties that lend Serenogen its application for the stress and wired profile. Here it is. This formula targets the heart and the impact of stress on the heart, based on the traditional Chinese model, which is why it is called a traditional heart calming formula. It would typically be for individuals who feel anxious, may suffer silently, feel very burned out and exhausted, but put on a happy face or have difficulty sleeping and suffer from hypertension. It is a calming, balancing formula, not stimulating at all, has a profound effect on mood, heart, blood sugar, and does support the adrenals by calming down HPA activation. It also aids in sleep support, specifically insomnia. It comes in two sizes, a bottle of 60 and bottle of 120, and dosing is anywhere from 2 to 6 tablets taken in divided doses throughout the day. This clinical summary highlights the kind of individual who would benefit from Serenogen. They will present with issues related to irritability, anxiety, and a feeling of being overheated. They may also present with metabolic syndrome, in which case we know that the Rehmannia in particular will help calm down inflammation and promote blood sugar balance. So, what if the section B scored greater than section A? Well, in this case, it places them in the stressed and worried profile, and the particular formula for this profile is called TranQ. You will notice how this web is quite different from Serenogen. It is a highly calming and very dedicated formula managing conditions like insomnia and mood, and is also involved in muscle relaxation, thereby helping with chronic pain. Polygala and Jujube are important features in this formula, which is a classic example of a holistic approach to managing emotional distress due to what traditional Chinese medicine refers to as a pattern of excess. In contemporary terms, excess can be translated as a physical state where the stress response is inappropriately revved up and body systems are in hyperdrive. Since the mind reflects the whole body, the mind is in a state of hyperarousal as well. Often an extremely challenging event can trigger an acute stress response, flooding the body with stress hormones, locking you into a negative spiral. Other times, unhealthy lifestyle choices in combination with prolonged social stress cause the stress system to turn on and stay on. So this kind of profile of patient is worrying about things big and small, has an obsessive thinking pattern, lies in bed awake replaying events over and over again, suffers from muscle pain with headaches, and those are all characteristics of this excessive mental and emotional state. Collectively, the 11 herbs in this formula send relaxing messages to the central nervous system whilst promoting healthy circulation, digestion, assimilation, and liver function. And all of these characteristics combined will help to ease mental tension. In traditional Chinese medicine, polygala has been associated with the management of mental disorders. You may notice that some of the ingredients mirror those found in Serenogen, with some very interesting and profound differences. The polygala, which is one of the chief herbs in this formula, was a lesser herb in Serenogen, whilst Rehmannia, which was the chief herb in Serenogen, is a lesser herb in this formula. Now, the reason for this is that polygala, or Chinese senega, is a herb that is much more focused on the central nervous system and on mood. And in the traditional medicine model, it's called the will strengthener and is used in emotional debility, whereas Serenogen is traditionally used for cardiovascular stress and heart palpitations. What we understand from animal studies today is that polygala appears to protect the body cells from damage caused by NMDA. That is the glutamate receptor, and when it gets agitated, it makes you feel really crazy and uneasy. So this is one of those receptors that you are wanting to calm down and relax. Here is some current research showing applications of polygala for an antidepressant effect and how it is able to improve neuroplasticity and as well as levels of bone-derived neurotrophic factor, showing its high degree of affinity for improving central nervous system function. Another chief herb in this formula is jujube, which shows effects on the GABA pathways to help produce a sense of calm. And when you increase GABA, you reduce the damaging effects of glutamate on the central nervous system and therefore alleviate feelings of severe anxiety and tension. This formula also combines polygala root, which as mentioned is the main herb traditionally used as a calming tonic to relax the mind, soothe emotions, and to aid in the sleep process. And it combines it with poria mushroom, biota, and sour jujube seeds. These herbs reinforce the action of polygala by providing additional relaxing support as well as helping to maintain the integrity and function of the heart tissue. Poria is a nourishing mushroom used in ancient times to lift the spirit and stabilize emotions. Current animal studies support traditional applications of poria as a calming influence. In vitro cell studies demonstrate a relaxing effect on smooth muscles. Traditionally, gardenia fruits clear heat and eliminates irritability. It is used for heat patterns with restlessness, stifling sensation in the chest, difficulty sleeping, and delirious speech. Tangerine peel supports healthy digestion and assimilation by promoting the movement of qi, the energy known in traditional Chinese medicine responsible for healthy organ system function. In combination with all the herbs in this formula, it aids in their movement throughout the body. So this is really a great formula for people who worry excessively and are inflexible or snap easily when stressed. They may also have OCD tendencies. I hope you can see how this formula is specifically targeting the mental aspects of an overactive stress response, as opposed to the more physical symptoms which Serenogen more readily addresses. So TranQ comes in a container with 50 in a bottle and can be taken daily at a dosage of between 2 to 6 tablets per day. Now, if you are thinking that you may not have time to conduct the questionnaire and specifically look at whether someone is more wired or worried, and you want to give them the best formula for someone who seems to be sympathetic dominant, or in a state of stress or overactivity, then I would say that Serenogen is your best bet. Consider that your default formula for sympathetic dominance. So what do you do for adrenal stress? Remember, this is section C. This is someone who has scored a high score above 10 in this section. The go-to product here is definitely Licorice Plus. It contains a concentrated extract of licorice, which is dedicated to the regeneration of adrenal tissue. The additional support products here to consider are Cortico B5, B6. And please note that Biosom is no longer available, so it's just the two formulas we use for adrenal recovery. So let's take a look at the pattern for stressed and hot, which is section C. There are 4 herbs in this particular formula, Licorice Plus, a standardized extract of licorice, and then that's combined with the supportive herbs, ashwagandha, rhamania, and wild yam. You will notice that rhamania shows up again because it's an anti-inflammatory adaptogen and is very useful in reducing heat and balancing blood sugar, something you always want to take into consideration when you're dealing with stress. If you look at the web pattern, you'll notice that the reach of this formula is balancing and highly supportive of the adrenals, slightly supportive of blood sugar, very supportive of immunity and respiratory function, as well as chronic pain and digestion. Licorice roots contain actives that help to mimic the action of cortisol and therefore take the strain off the adrenal glands, thereby helping them to recover. It also has direct immune modulating and anti-inflammatory effects. The standardized extract in Licorice Plus provides maximal support for cortisol and is a great formula for those who exhibit low blood pressure, body aches and pains, as well as cravings for salty foods. So as mentioned, our formula makes use of a standardized extract of the dried root of the licorice plant. The root has been standardized to provide 25% glyceric acid, which is the active component that has a cortisol-sparing effect and makes it effective in helping patients whose adrenals are not able to produce adequate amounts of cortisol in order to meet the body's demands. It's very important when using licorice therapeutically to know how much glyceric acid is in the product so that you know how to dose effectively. Excessive intake of glyceric acid has been associated with potassium loss from the body, leading to pseudoaldosteronism, which presents as hypertension. For that reason, people with existing hypertension are not the best candidates for licorice-containing formulas. As you can see from the summary slide, licorice has many added benefits, which support multiple other body systems, not just the adrenals, but also improve digestion, immunological support, as well as antioxidant benefits. The supportive herbs in Licorice Plus, as mentioned, are ashwagandha, rhamania, and wild yam, because they complement the formulation and have effects throughout the body as well. Ashwagandha in particular provides additional immune support which partners with the licorice action, and the same can be said for rhamania, which works with the licorice to regulate blood sugar and inflammation. The yam is tonifying and supports digestion and assimilation as well. So who would use Licorice Plus? You would look at individuals who are underproducing cortisol, who are on non-steroidal anti-inflammatory medication. It's going to have a chronic restorative effect on these individuals. Anybody who has conditions that might predispose them to using NSAIDs or prednisone, then licorice would be an appropriate intervention for them. Anyone who gets constant colds, has dry coughs, these individuals will have a high score in section C of the questionnaire. Remember, licorice is not suitable for patients who are hypertensive or on blood thinners. So licorice comes in a bottle containing 60 tablets. It's important to note that with this formula, you do not need to take more than 3 tablets per day. The recommended dose of glycyrrhizin is 100 to 200 milligrams per day, and Licorice Plus provides 180 milligrams of the active glycyrrhizin in 3 tablets. This dose can safely be used for 3 to 6 months with no negative side effects, and that's the value of a standardized extract. It's important to know just how much of the actives are present per dose so that you can ensure safety and efficacy. So remember, the other option for adrenal support and recovery is cortico B5, B6. This is an intense mixture of pantothenic acid, vitamin C, magnesium, and bioflavonoids. And it's like an adrenal spark plug formula that provides all of the building blocks for adrenal hormone synthesis and supports the optimal functioning of the adrenals. This is a good alternative for people who score high in section C but can't take the licorice plus due to having elevated blood pressure. But it can also be combined with the licorice plus for anyone who scores greater than 21 in section C. You only need to take 1 tablet a day, so this container will last for 2 months. If the ABC subsection score is very, very high, coming in at greater than 63, you may want to consider adding in a neurological support formula called Trancor. It's been formulated to support a sense of tranquility in those who feel worried or nervous by beneficially modulating the balance between GABA and glutamate. Designed to act centrally within the brain, this formula features the amino acids NAC and taurine, which research suggests can cross the blood-brain barrier. It then combines those ingredients with green tea catechins, vitamin B6, and magnesium. We will actually be discussing all of the neurological support formulas in Module 7, which is the next module, which will form part of this training program. So let's continue with our core stress products and look at what happens when the stress response doesn't engage or when there's an inadequate response. These kinds of symptoms will be represented by a higher score in section CDE. If you look on the scorecard, you can see 2 stress subtypes that fall into this category. And we're going to focus in on when D is greater than E, which correlates with mentally fatigued. But before we look at Exhilarine, let's have a look here. Exhilarine is the formula for this particular condition. It targets mental fatigue. It's for patients who cannot concentrate well, have difficulty making decisions, and suffer from impaired memory. So if you look at this particular web, you can see that it tends to be mildly stimulating. It is not calming, but rather has a balancing effect on the HPA axis, provides moderate adrenal support. You can also see that it has a high affinity for mood, cognition, and benefits related to immunity, and can also help you if you have a tendency to oversleep. So this is a mildly stimulating formula, and it's designed for those individuals that have trouble engaging the stress response and are suffering more from the cognitive effects of prolonged stress. These are a series of articles that talk about Ayurvedic adaptogens, otherwise known as Rasayana plants, of which ashwagandha is viewed as one of the superior botanicals in this classification. Also known as Indian ginseng because its properties appear to be rather similar to ginseng. This monograph on ashwagandha summarizes some of the profound effects of this herb. It is considered a vitalizer or rejuvenative tonic, traditionally used for improving stamina, fatigue, physical and mental stress, as well as insomnia. So when you look at this herb, it is for someone who is truly fatigued. These articles discuss the impact of ashwagandha on brain function, and it's interesting to note that there seems to be cholinergic agonism. What this means is that it allows acetylcholine to express itself. Acetylcholine is one of those excitatory neurotransmitters that becomes engaged when your stress response goes off. When your alarm system is activated, it's a wake-up call, and waking up involves paying attention, that's adrenaline, engaging, that's dopamine, and then remembering, thinking and making decisions, that's acetylcholine. Ashwagandha has been demonstrated to keep levels of circulating acetylcholine, the memory and thinking neurotransmitter, higher. Another partner in this formula is holy basil, a great aromatic adaptogen that has been shown to be useful for cognitive disorders and could even be beneficial for dementia and Alzheimer's. Although there are no human clinical trials at this point, but the mechanism of action suggests benefit. In terms of stress and not thinking clearly, it has tremendous value. If you note the second bullet point, which states that holy basil is able to reduce concentrations of glucose and cortisol, providing antiperoxidative, hypoglycemic, and hypercortisolemic effects, which means that holy basil is allowing cortisol to be used more efficiently. So it puts a damper on too much cortisol having to be produced, whilst also using the available cortisol better. So it really has that balancing impact that defines what an adaptogen is. Another component of Exhilarine is Bacopa monnieri. Ayurvedic literature attributes its benefits to its ability to produce non-specific increased resistance. It revitalizes nerves, brain cells, and the mind, and helps to strengthen the adrenals and purify the blood. In animals, it has been shown to improve adaptogens in sensory, motor, and motivational systems, while in humans, it exhibits beneficial effects on anxiety and mental functions, particularly as it pertains to fatigue. Effects on the central nervous system may be mediated through the stimulation of GABAergic and cholinergic systems. Bacopa leaf's traditional use targets the nervous system, loss or lack of bodily strength, debility, weakness, chronic fatigue syndrome presenting as memory loss. Today, Bacopa's active principles have been extensively investigated in several laboratories for their neurological effects, and a number of reports are available confirming their cognitive action. The formula is complemented with the addition of amla fruit, which is balancing, cleansing, rejuvenating, and nourishing. Amla is rich in vitamin C, an essential micronutrient depleted by stress. It is believed to support all internal organs of the body, including the brain, by gently promoting internal cleansing, whilst improving digestion and assimilation. So this formula is really well suited for those experiencing cognitive decline under stress. It's a great balancing formula which provides a broad range of stress protection because of the unique combination of ingredients. Exhilarine is safe for daily use and can be dosed at 2 tablets 2 to 3 times daily. Okay, so now let's look at the other type of inadequate stress response, the subtype stressed and tired, which correlates with a higher score in section E of the questionnaire. This ginseng and cordyceps formula is designed to enhance stamina and energy, providing exceptional support for those who are stressed and tired. It's ideal for those who are exposed to prolonged elevation of stress hormones with resulting exhaustion. The formula features standardized extracts of Asian ginseng, rhodiola, and cordyceps, highly valued adaptogens that stimulate and nourish a tired stress response whilst promoting balance. Backed by modern research as well as thousands of years of traditional cultures' use, these adaptogens are among the leaders in providing natural support, thereby building resilience. Patients who would benefit most from this present with severe fatigue or chronic fatigue syndrome, fibromyalgia, apathy, or depression, and weight gain. Traditionally, Asian ginseng has been used to stimulate mental and physical activity, thereby improving stamina and fatigue and increasing resistance to stress. Ginseng produces sustained and profound clinical effects when given at levels associated with traditional recommendations. When you are choosing ginseng raw materials, you want to choose roots that are 5 years or older, that use the whole root. When you look at the phytochemistry of ginseng, it is very paradoxical. There are numerous ginsenoside subtypes, which are among the actives in the root, of which RG1 and RB1 are important ones to highlight. And you will notice that they have contradictory effects in the body. One increases blood pressure and central nervous system activity, whilst the other reduces it. But traditional application of the root as a whole shows that Panax ginseng has a stimulatory effect on the HPA axis overall and increases adrenal function and cortisol levels. Ginseng works very nicely with licorice, so Adracet combines very well with licorice plus. But keep in mind that licorice plus combines well with any of the adaptogen formulas discussed so far. Other components in the root are B vitamins and flavonoids, so you're looking at a very complex ingredient. The current directions on Adricet reflect the European influence on ginseng administration for enhancing endurance, which represents the lowest dose of ginseng recorded in traditional texts. The traditional model is still the gold standard for administering this plant if one is dispensing for chronic conditions. Crude Asian or steamed ginseng is given at levels typically ranging from 3 to 12 grams daily. The crude root contains approximately 3 to 5% ginsenosides. 3 grams of crude ginsenosides would supply roughly 90 milligrams of the actives. Our ginseng extract is standardized to 8% ginsenosides. So 1 capsule of Adricet supplies 16 milligrams of ginsenosides, and 6 capsules would supply 96 milligrams. So at 6 capsules per day, we would be recommending slightly more than the lowest 3-gram dose. Animal and human research studies suggest that ginseng may influence the activity of the HPA axis through a variety of mechanisms. But don't confuse individual ginsenoside chemistries with the health benefits of the whole root. All of the components of the root work together to provide appropriate stimulation of the pituitary and also by improving cortisol sensitivity and inhibiting adrenal and thymic atrophy. Recent research published in 2010 in the Cochrane collaboration looked at the effects of ginseng on cognition, behavior, and quality of life, and found benefits in all of those areas after doing a meta-analysis of available studies. Cordyceps, another component of Adricet, is a medicinal fungi in one of the most valued plants and is considered one of the most valuable plants in Chinese medicine, where it's traditionally used as an adaptogen to support vitality, as a lung and kidney tonic, and to stimulate libido. It has similar properties to those of ginseng, such that it is traditionally used to strengthen the body after exhaustion. Ginseng and cordyceps are frequently combined as they complement one another to support overall vitality. In Adricet, rhodiola is not positioned as the chief herb in the formula because the formula is designed to leverage the traditional applications of the mature ginseng root and the cordyceps. The rhodiola, however, is a wonderful complementary adaptogen in the formula with many benefits such as libido boosting, increased work capacity, and immune function as well. So Adricet is a great trinity of ingredients that is an excellent option for chronically stressed and tired individuals. This case report from the Functional Medicine Research Center, the research arm of Metagenics, used Adricet combined with licorice plus and cortico B5, B6 in a person with a depleted morning cortisol level. And you can see that at 2 and 5 months, that protocol sufficiently raised cortisol levels to within the reference range. In terms of dosing with Adricet, you would be using as little as 2 capsules to as many as 8 capsules a day. And this depends on the degree of exhaustion the person is experiencing. The deeper the fatigue, the more ginseng is required. Traditional applications show quite high levels as being highly restorative and safe, and even at 8 capsules a day, the ginseng dose is only equivalent to the lower dose used traditionally. However, the synergy between all 3 ingredients ensures efficacy and the desired clinical outcomes. Adricet is preferably for individuals who are not anxious, jittery, or feeling stressed and wired. It is contraindicated for those excited states. Do not use with antidepressant medications or monoamine oxidase inhibitors, MOAs. It's better taken during the day on an empty stomach, 20 minutes before food. I would like to highlight the fact that the formula for chronic scores where C plus D plus E is greater than 63, which is noted as Symphora on the scorecard, has been replaced by another formula called adrenogen. Adrenogen focuses on the adrenal glands and is a consideration for severe adrenal fatigue. With a blend of B vitamins that are involved in adrenal hormone production, as well as freeze-dried raw adrenal concentrate, it supports cortisol production, repair of the adrenal glands, and the inclusion of PABA helps to potentiate cortisol action. You can take 1 to 3 tablets daily, which can be combined with Adricet in severe cases. The final step involved in supporting individuals with their stress levels is by addressing their stress response with tips to quickly reduce stress, as well as smart eating tips which prevent stress hormone surges. Check your resource folder for a handout sheet on 9 tips to reduce stress quickly. This includes tips such as breathing techniques, visualization, and exercise. Another handout focuses on smart eating tips that prevent stress hormone surges associated with missing meals, comfort food cravings, and overeating. So the identity stress assessment is an easy to implement 3-step approach with all the tools in place to help you help your patients manage their stress better. Patients who engage in this program will regain perspective, energy, mental clarity, and balance in their lives. Thank you.